9 symptoms of pancreatic cancer you must not ignore. Could be fatal. Most people don't realize this, but pancreatic cancer is quietly becoming one of the deadliest cancers in the world, surpassing even breast and prostate cancer in death tolls across many countries. And the most frightening part? It often goes unnoticed until it's too late. In the US alone, over 65,000 lives are lost to it each year, and the 5-year survival rate hovers around just 12%. Nearly 80% of patients ignore early warning signs, brushing them off as everyday discomfort. But here's the hopeful part. Warning signs often show up 3 to 6 months before diagnosis. Recognizing them early could truly save a life, maybe even yours. 9. Early warning signs of pancreatic cancer. Number 1. Let me ask you something. Have you been dealing with nausea, bloating, or indigestion that just won't go away? Not just after a heavy meal, but week after week? This could be your pancreas quietly crying for help. You see, the pancreas plays a vital role in digestion by producing enzymes. But if a tumor begins to block the pancreatic ducts or reduce enzyme production, food, especially fats, can't be properly broken down. That's when you may notice pale, greasy stools with a foul odor, unexplained weight loss, or even muscle wasting. These aren't just annoying symptoms. They could be early warning signs of pancreatic cancer. Number 2. Persistent fatigue and weakness. Let me ask you, have you ever felt tired, even after a full night's sleep? I'm not talking about the usual end-of-day tired. I mean a deep, bone-level exhaustion that doesn't go away, no matter how much you rest. This kind of fatigue can be one of the earliest red flags of pancreatic cancer. Why? Because cancer cells are greedy. They steal your nutrients and energy, leaving you drained. Even simple tasks, walking the dog, climbing stairs, can feel overwhelming. And to make it worse, emotional changes like anxiety and insomnia often creep in, amplifying that sense of helplessness. It's not just being tired, it's your body trying to warn you. Number 3. Recurring fever and chills. Have you ever experienced a strange fever that comes and goes just enough to make you feel off, but not quite like the flu? That could be your immune system reacting to something deeper, like inflammation in the pancreas, or even a growing tumor. These fevers often strike without warning, sometimes with night sweats that soak your sheets. It's not your typical infection. And here's something critical. If you're also noticing yellowing of your skin or a sign of bile duct blockage, these fevers may become more intense and dangerous. Don't dismiss them. Your body could be waving a red flag. Number 4. Unusual blood clots. Let me ask you something. Have you ever had unexplained swelling or pain in your leg, maybe with redness and warmth? Most people wouldn't think cancer right away. But here's the thing. Pancreatic cancer can make your blood unusually sticky, increasing your risk of dangerous clots. These aren't just minor issues. Deep vein thrombosis, DVT, can lead to a life-threatening pulmonary embolism if that clot travels to your lungs. Sudden shortness of breath, chest pain, or a racing heart, those are emergency signs. So if you notice a strange leg cramp that doesn't go away, don't brush it off. Your body might be warning you. Number 5. Enlarged liver or gallbladder. Have you ever felt a strange firmness just under your right rib cage, like something was swollen that shouldn't be? That might not be indigestion. In some cases, a tumor in the pancreas can block the bile ducts, causing bile to back up and enlarge your gallbladder or liver. This kind of swelling can be silent but serious. You might even be able to feel a hard lump near your side. It's subtle, but it matters. If something feels off, ask for an ultrasound or a CT scan. Don't wait. These organs don't swell for no reason. It could be your body's early warning sign. Number 6. Persistent bloating or fullness. Let me ask you, have you ever felt uncomfortably full after eating just a few bites? Like your belly is stretched tight, even when you haven't eaten much? This isn't your average case of indigestion. When the pancreas isn't working properly, it can't produce enough digestive enzymes. That means food doesn't break down like it should, and you're left with lingering bloating, fullness, and that stuffed sensation. And here's the thing, it doesn't go away with antacids or a bland diet. If this kind of discomfort becomes your new normal, it could be your body's quiet cry for help. Don't ignore it. Number 7. Dark urine that won't go away. Have you noticed your urine looking darker than usual, like the color of strong tea even though you're drinking plenty of water? This might seem like a small thing at first. Maybe you think it's just dehydration or something you ate. But here's the truth. When a tumor presses against the bile duct, it can block the flow of bile, causing bilirubin to build up in your body. Often, the first sign isn't yellowing of the skin, it's dark urine. If this change lasts more than a few days, don't brush it off. Your body could be waving a red flag. Number 8. Unexplained itching that won't quit. Have you ever had an itch that just wouldn't go away, no rash, no bug bite, and no relief from creams or antihistamines? If that itch is deep, persistent, and mostly affects your hands, feet, or back, especially at night, it might be more than just dry skin. When a tumor presses on the bile duct, bile salts can build up in the bloodstream and trigger intense itching. Sometimes this strange symptom shows up before any yellowing of the skin. It's subtle and often dismissed. But if the itch lingers without a clear cause, it's time to ask your doctor why. Number 9. Sudden diabetes or blood sugar swings that don't make sense. Imagine being told you have type 2 diabetes out of the blue. No weight issues, no family history, no warning. Or maybe you've managed your diabetes for years, and suddenly your blood sugar won't behave even though you haven't changed a thing. When this happens, it's time to take a closer look at your pancreas. This organ quietly manages insulin, and when a tumor disrupts it, blood sugar control can spiral. Shockingly, up to half of pancreatic cancer patients experience abnormal blood sugar before diagnosis. So if something feels off with your diabetes, don't ignore it. Ask your doctor why. Pancreatic cancer is often called the silent killer for a reason. It whispers, not shouts. It hides behind symptoms we're quick to dismiss. A little indigestion, feeling more tired than usual, or darker urine that we blame on dehydration. But sometimes, those small signs are your body's quiet plea for help. If you or someone you love has chronic digestive issues, unexplained fatigue, or odd changes like dark urine and weight, ask questions. Get checked. It could make all the difference. Because in the end, knowledge really is power. And sharing that knowledge, that could save a life. Maybe even your own.